that? How can you guys see that okay? Is that better? Good. Good, good, good. All right. Okay, I'm going to go ahead and get started here. I already pulled over a left wrist case. So the very first thing we're going to do is we're going to go ahead and see what kind of coil we're going to turn on. And we are going to turn on the Sense Flex M. Proceed and start. And this is a full field of view. So notice how, you know, it's going to be rather small here on these particular pictures. Then I'm going to do a 3-plane pilot, right, oops, golly, Flex M. And we'll just put that field of view right over the anatomy here. Proceed and start. So my second 3-plane pilot and as I page through these, okay, notice how it's going to show up like that for my coronal. Here is my sagittal, probably the best sagittal. And then the axial is probably going to, I'm going to pick that. Can you move the camera up so I can see the slice in image? Is that better? Let's start recording this here. Okay, so that is better, Chelsea. Good. So my 3-plane pilot then that I took on this second survey, I just kind of paged through all of my images, and I have my coronal. This was the best coronal, this was the best sagittal, and then this is the best axial for me to start placing my slices off of. So if I look at my wrist practical sheet, which is, this is what I'm using here, you guys should all have it, okay? I'm going to set up a T2 axial, okay? And when I double click it, trying to see where my lines went. There we go. So if I go ahead and position all these to be straight, notice I have my field of view over my axial viewport. So this is my axial slice. So the field of view that you want to pick, and I'm going to go ahead and I'm going to open the handbook of MRI scanning to where the wrist is located. And the field of view that they use on a 1.5 is between a 10 to a 12 field of view, or between a 100 to 112. Now, I have my A to P at 100. My right to left is 131. If you'd want to go to a 100, notice how pretty tight, it's going to be real snug there. I can go ahead and see how I'm going to do once I start positioning my slices here. So I want to angle my slices to be perpendicular here. Do you see how I have my honor bone and my radius bone here? So I'm going to go perpendicular to that, which you can kind of see on this coronal And I'm pretty tight right to left, so I'm going to go back, and I think I want to open up my right to left at a 120. I'm okay A to P, but I want to make it it's a little bit wider in that right to left view. If I look at my sagittal, notice how I can see it looks like this is probably part of the ulna there. I'm going to also angle to be perpendicular so I get a true axial slice. Okay, now my slice thickness, they like to use a 2 to 3. 3 is probably the most standard, so I'm going to do a 3 millimeter slice thickness. I can go to a default, which would be a 0.3. I think that looks fine. I like my field of view. I set that up originally there. I've just angled my slices, and I want to make sure that I start above my carpal bones. So I am into, these are your metacarpals. I'm definitely through. What was I angling on the sagittal? If you notice, see how this is one of the bones in the forearm? And I'm going to say that's the ulna bone. I'd have to kind of page through to be sure. But if this is going at this angle, in order to get a true axial, I'm going to go ahead and be perpendicular to that. Does that make sense? Okay. So it's because of how this patient is laying in the magnet. They're lying in the magnet kind of with that arm, if it's above their head, at an angle, right? So here on this coronal, this is my Druze joint, that distal radial ulnar joint. And I am all the way through that. So I have 30 slices. If you feel like that's too many and you want to bring it down to maybe 26 slices, just make sure you know you're into that joint yet. And now I can page through, and I'm still into my metacarpals. So this would be fine. If that your patient is having a lot more pain, maybe over the distal radius, then you would maybe want to add those slices back to make sure that you get the area where that patient's pain is located. But technically, if you get all of these carpal bones, you have your Druze joint, you're into the metacarpal bones of the hand, we've included the entire wrist joint, okay? My voxel size is 0.6 by 0.6, so I do have good resolution here. If I go to my phase encoding, I'm setting up a transverse, and I can either go, if I look over here on my axial, I can go A to P or right to left. And so whatever you pick is going to be up to you. Now just remember, it's different if the arm is above the head in the Superman pose, because maybe there is nothing right to left of that wrist. If the arm is down by your side and it's in the wrist coil down by your side, then you have to worry more about right to left because you have the body located there, okay? In this particular case, I'm going to assume, because I don't see the anatomy of the abdomen by it, I'm going to assume this was scanned in the Superman pose. So therefore, right to left, I have no issues with wrap, nor do I have any issues with A to P. So as far as fold over suppression, I can turn that off because that is not needed, okay? Now, rest slabs. Do you want to put a rest slab? Well, if you do, and that's totally fine, let's turn on one rest slab, and we want to minimize the arterial flow which would be in this direction, because we know the arterial flow is coming down from the forearm. If I put it here, then I'm just going to minimize venous flow. That's going to be coming back through the wrist here. But arterial flow is a lot faster, so I want to minimize that and position that here. Okay? So this is a T2 weighted image. I'm going to go to my contrast. And I have right now a TR of 2,853. I have a TE of 80. And I have a 22 turbo factor. And with all of those parameters, this will give me a T2 weighted image. It does not say fat sat on my protocol page. So I'm not going to need fat sat turned on. And I can go down to where it says fat suppression, and it says no, there is no fat suppression turned on. So this looks good. It's 3 minutes and 25 seconds. And I think that looks good. So we can now go ahead and proceed and start. Well, over in my axial viewport here, I'm going to pull up a better looking axial, because I just took it, right? And that's what this series is going to be. This is my nice axial slice. And as I page through here, I notice that this bigger bone is my radius, the smaller is going to be my ulna. And as I page all the way up where I'm getting into the carpal bones, okay, right off the bat, when you see within the center a little tunnel here, and you see all of these black structures, this is your carpal tunnel, okay? The black structures up here would be your extensor tendons. The tendons in the carpal tunnel would be your flexor tendons. And can you guys tell me what nerve is also located within the carpal tunnel? You guys remember from lecture? Yes, very good. Thank you for paying attention. So when I'm looking at these axials, it is hard for me to tell what bone is what until I get to this particular one where I see this hook. And this hook here is the hamate bone right off the bat. Okay? Now, let me go ahead and silence that. Okay, so we have our axial, nice axial added to this third viewport. I'm going to now set up for a T1 coronal. If I straighten my slices up here, I can see my field of view box here. And, you know, many times it might come up just straight on your screen like this. But I know I want my coronal to be straight when it is being reprocessed. The field of view that I have is a 120 by 120. And this actually looks good. In your book, it uses, again, a field of view between 10 to 12 centimeters. And we are at that 12 centimeters here by 120 millimeters, okay? So this looks pretty nice. I have coverage of that Drew's joint. I am into my metacarpals. So all of the wrist area is included here. If I go over to my sagittal viewport now, notice if I want to get a true coronal, well then I want to angle it with that ulna bone. So that's why I'm going to put an angle right off the bat here, and I'm going to cover skin to skin. I'm going to proceed on to my axial here. I'm going to take my slices off so you can see my line. So through these axials, as I'm paging through, what you'll technically want to do is take a slice and go right through that carpal tunnel. You know, here is my carpal tunnel. So go ahead and get that angle, and then just make sure you cover skin to skin. I'm going to turn my slices back on here. I'm going to choose a slice thickness of 3. I can let it at default, which would be a 0.3 gap. I have 18 slices. And I want to page through all of these to make sure I'm not, as I'm slicing through, that I'm not going to cut off anything. And if you feel like you're going to be close with cutting off maybe some of this extensor tendon up there, by all means, go ahead and add a slice if that, you know, feels good, or maybe move your slices up. So now as I page through, am I going to cut off anything in this anterior? And I think I'm actually good. There's a little bit of skin, but that skin is just going to be probably in this area here. So I think we are good to go. Notice also that I am basically taking a slice, or not a slice, but the angle going right through the ulna and the radius bone. So that angle is going to be the same as the angle that I'm choosing right through the carpal tunnel. So again, I'm just going to kind of page back and forth to see where I want to move these slices to. And I think that looks good. So I can turn my slices back on so you can see how we're cutting. So I have my geometry set up nicely. I have a voxel size of 0.6 by 0.6. You can also, again, turn on a rest slab and position it the same way that you did for your axial, just to kind of minimize flow coming down into your slices. Okay? I'm doing a coronal, so if I look at my coronal viewport here, I have the option of going right to left or head to foot. If I would choose to go head to foot, I'm going to need to turn on fold over. If I keep it at right to left, I do not need fold over because I have no anatomy in the right or in the left here. I do not have anything wrapping in. And I'm going to choose to keep mine going right to left here. This is a T1 coronal, so I'm going to go to my contrast page. I don't like my TSE factor that high. I'm going to bring it down to 3. I have my TE at 25, and I have my TR in a range of 300 to 700, which brings my actual TR to 563. My actual TE is 25 with a 3 turbo factor. Okay? If you felt like you don't like that 5-minute scan and you want to bring it to 4, that brings it under 4 minutes. But if you let it at 3, let's go to my motion tab. And I have a 4 next. I'm going to go ahead and just bring 1 next down, bring it to a 3 next. It's under 4 minutes. Notice though I'm at first level, and it's okay to scan at first level as long as there is nothing that patient has in regards to an implant that tells me that I should only scan in normal operating mode. Okay? If you feel like your patient cannot hold still for, let's say, 4 minutes, go back to your geometry. You have a sense coil, turn it on, and maybe go to a 1.3 P reduction, and that brings you down to 3 minutes. So those are just things that you can do in the field to go ahead and quicken up your scans and still, you know, have nice quality images. So we can now proceed and start. Well, now I have a better coronal. So I'm going to look for my coronal. And this is a coronal here. Okay. Right off the bat, I can see that this is my radius. This is my big bone here. This is my ulna. And I can see that the ulnar styloid here. And again, what is those 4 letters that represent this space? Can anybody tell me? Aubrey, what is this space?
I have no idea. I accidentally hit that. I'm sorry.
No problem. But the answers are right along. We're in the chats here. But yeah, Christopher and Shalika, perfect. This is where your TFCC lies. Okay? And then you have your bones of the carpal bones shown up. And right off the bat, when you see that in the very center, that very big bone in the middle, we know right off the bat that is the capitate bone. And then if I look right above the radius, you see like more like a kidney bean. This is your scaphoid. Then it goes to the lunate. And then over here is that triquetrate. And you don't really see that real small pisiform. You can see maybe a little bit of it that would lie over on top of it, okay? But just position, find that coronal where you're almost right in the center, because what we're going to set up next is a T2 spare sagittal. So I'm going to double click that. Trying to get my slices here to populate. And where did my slices go? Let me go back. They're way over here, so let me bring her on over here. Go back to my coronal here. Okay, so I'm going to pick my coronal where it's in the center. I'm going to go ahead and bring my slices down. You can bring them straight so I can look at my field of view. I want to straighten this field of view up slightly. I'm putting a little bit of an angle to it. This is my sagittal viewport, and I want my sagittal to be a perfect sagittal, right? Over at the axial viewport, I'm going to make my slices to be perpendicular to the carpal tunnel. Remember when we did coronals, we did them like this. And they were perpendicular here, or parallel. Now we want to be perpendicular, right? And if I look over at my coronal, I want, go ahead, Shalika.
What are you angling with on your coronal?
This coronal, I was just telling you that right now.
Okay.
Yep, no, I'm looking at my axial, and I'm going to be perpendicular to my carpal tunnel. But once I come over to my coronal, I want to be parallel. Almost think about, I want a line going through my radius and a line going through my ulna. Okay? I'm going to then just go to the center of my carpal bones, and I'm going to definitely need to add some more slices. If I look at my field of view, I have a 100 by 100 here. So this would be a 10 centimeter field of view, and that actually looks pretty good. I'm definitely up into the field of view up here. I'm into my metacarpals. I've got images through my Drew's joint. So I like my field of view. I just need to make sure I add more slices. I have a 3 millimeter at default, which is good. And I'm gonna maybe go to 22 slices if that gets me skin to skin. Here I'm in the skin, here I'm in the skin. If I look at my axial, you know, I've pretty well covered the entire metacarpal, or the entire carpal bones. What you're seeing out here is this up here in the hand. So this outside and this outside is the soft tissue up here in the hand. So and I'm doing a wrist. So if I get from this wrist skin to skin, I'm good. I can turn my slices back on here. Okay? Now this is a T2 spare, so I need to go ahead and I'm going to turn my shim to the volume here so I can manually position it here. Change that, my shim align to yes, I want to align it myself. Oh, let me go back to no. Let's see if it allows me to do this here. I'm trying to click on it here. There it goes. So now I'm going to bring my shim box in anterior to posterior here because I don't need to shim air. But I do want to cover left to right. So I've got my shim box covered. Shalika, do you have a question? No? Okay. So I like how I've set up my geometry tabs here. I like my field of view. I like my slice thickness. I like my number of slices here. Because this is a sagittal, I'm going to go ahead and look at this sagittal and say, I have two directions of phase. I can go head to foot or A to P. If I go head to foot, I need fold over. If I go A to P, I do not. So I'm going to go ahead and change my phase to go A to P. Therefore, I do not need fold over. And the reason that that's going to be important then is when I go to my motion tab and I have 4 necks, I'm going to get a 4 necks in my scan. Okay, so I'm going to now go to my contrast. This is a T2 spare, so I have 3,247 and I have a 90 TE. That's going to give me T2 weighting, 22 TSE. If by chance my radiologist comes back to me and says, you know what, I want this to be more T2 weighted, then I can take my 90 and I can maybe bring it up to 110 if that's what the radiologist wants. Notice though, and always think about, when you turn on FAT-SAT, you are taking the fat signal out of your picture. So therefore, you're going to lose some signal because you don't have the fat signal. And anytime you go up in TE, you're losing signal. So if you're doing a FAT-SAT T2, it's probably advantageous to keep that TE down. Maybe even from a 90, bring it to an 80. You'll still get T2 weighting, but you'll get a little bit better signal because your TE isn't as long. So hopefully that makes sense to you. Okay, so I have again under 4 minutes. It's 3 minutes and 53 seconds. And I think my patient can hold still for that long. You are good to go. You can click proceed and start. If you're in there and your patient is telling you, you know what, my arm is killing me, I cannot keep it in this position any longer, then you can say, well, give me about 2 minutes. I'm going to bring my necks down to 2, and you can scan it. Or you can say, you know what, I just need to get one more set of pictures here. Turn on sense. I have to change my coil, that's why it's giving me that conflict. Change it to your P reduction of a 1.3, and that'll bring your time down to probably under 2 minutes. So those are things where in the field, you are going to be, you know, thinking and critically thinking of what can I do to make this faster so I can at least get a picture and get this exam completed for this patient and still get a diagnostic image for the radiologist. Okay? So we are done then. I'm only asking you to set up 3 sets of pictures, an axial, a coronal, and a sagittal. I showed you how to angle for them. Everything else then is basically the contrast or the weighting that you need. Now, part of this practical does require you to understand anatomy. So I'm going to go to viewing. I'm going to have you pick series 4, which is this one, okay? And then I'm going to tell you to point out to me where are the flexor tendons. And I know the flexor tendons are the tendons that is in the tunnel, and that's right here. Okay, you can it's almost like you can draw a circle right through that. So notice that within this carpal tunnel lies your median nerve somewhere. Out here, this nerve is the ulnar nerve, and it's outside the tunnel. Okay? I'm also asking you to show me the hamate, so I'm going to page through and find that hook. Go back up, there it is. Once I see this hook, then I know that that is the hamate bone. That is what is indicative of that. Also, where's the radius and ulna? Well, once I go down here, I know that this larger bone is the radius and the smaller bone is the ulna. Under series 5, which is my T1 coronal here, okay? I'm asking you to show me the scaphoid or navicular. And I know that's right above this radius, and that is this structure here. So that's scaphoid, and right next to the scaphoid is the lunate. Here's that styloid process, and here is this area, this space that we call that triangular fibrocartilage complex. Okay? And I think that is all that I'm asking on this particular one. It would be advantageous for you guys to kind of page through all of these and just see if you can find any kind of abnormalities. Now the bones look good, but look over here, there is some kind of abnormality signal showing up in this lateral aspect. Whether it is just swelling or whether there is a tendon issue with this, it's on the radial side with like a radial collateral ligament. I don't know. But it's kind of nice just to kind of page through these so you can see what coronals and axials in different weighting looks like. This particular image here are sagittals. So what's nice with the sagittal plane is you can see the tendons that's coming up through the tunnel here anteriorly, and then your extensor tendons in the back of the wrist in the posterior region. If you ever are looking at these images and you say, well, what is that? What kind of weighting is that? Go to this box up in the top. It's kind of almost like a yellow color, and it'll tell you it is a T2 spur, so it's a fat sat, TR of 4,193. They dropped their TE down to 65, 3 millimeters thick, turbo factor of 14. They have a 6 necks. Total scan time was 3 minutes and 25 seconds. So, you know, that will kind of get you familiar with looking at images, and then to also to say, well, what kind of weighting is it? That's huge. Sound good? How's that sound? Any questions on the wrist? You're terrified by how simple this is? No, that should make you happy. Finally, huh? Or I think it's maybe just because you guys are getting so comfortable with the simulator too, which is good. Oh, I gotta go back to, the reason I can't close out of this is anytime you have something open, you have to close out of it. So now I can do a cleanup. And then let's now proceed to do an MRI of the thumb. And we have 2 cases in here. We have a female case and also a male case. So I don't remember the differences again. We go to upper extremity here. Notice that there is a thumb protocol built in. It's a left thumb. Right off the bat, I'm going to go ahead and choose my coil, and we're going to do the Flex M coil. If you want to set this up and put their thumb in a knee coil, that would be fine as well. There. Now, right off the bat, notice that this full field of view, this was scanned with the hand down by their side because I can see the abdomen beside it here, okay? So I'm going to now go ahead and do another survey, smaller field of view right over that left area there. Proceed and start. And pull up a better coronal and sagittal. And it looks like, again, these are going to be kind of obliqued, but here's my thumb here. Okay. You can see here's the fingers. Yeah, Shalika.
On the paper it says under viewing series number 5. So does that mean we set up our axial off of series 5?
Well, you know what? The reason that I put this up here is because, and this is why it's crucial to get a good localizer. Because I can see, and it's only because, you know, I mean, I've scanned, I know that this is the thumb, but it might be hard for you guys to pick out, is that the thumb or what? This looks like it's a good sagittal of the thumb. And these images here are kind of almost a coronal oblique of the thumb, but they're not nice, pretty pictures. Do you agree with me? That's kind of why when you are in the real world and you are doing your localizers, you know, you can angle your localizers to get a nice 3-plane pilot scan. And again, it's only going to be an additional 30 seconds, if that, okay? So under viewing series 5, I'm going to see what that was. That is that is an axial. So I'm going to go ahead and show you what an axial of the thumb should look like. So these are axial images of the thumb, okay? Now, as I page through, notice right off the bat, I can see my sesamoid bones, which are right here. And that's crucial to find when you are setting up for your coronals and sagittals, okay? I'm trying to think if the last time we did that, if we chose to pull this up to get our field of view that we wanted, or let's see, I think with the thumb, I think we could still use our 3-plane pilot, okay? So this is your thumb, and then these are your fingers. So if you page through that, and you can kind of almost tell this is the thumb because you've got this thicker thenar muscle, which is that fatty part of the thumb, okay? So this is really where my thumb is located. This is somewhat of a coronal oblique, and this is a kind of a, looks like almost like a sagittal. There we go. So the very first thing that we're going to set up for is an axial T2. Okay, I'm going to straighten my lines up here. So we could go ahead. Going to get into the thumb area. Now here's where my field of view shows up. And I'm going to choose a field of view of about 10 centimeters or 100 millimeters. If you wanted to go even smaller to like an 80, because I'm only interested in the thumb, I don't have to worry about getting any of the 5th finger back here. That's okay. You can do that. You know, you're going to get a smaller field of view. Just make sure you're going to get enough signal though in your image as well. So here is a slice thickness. We can use 3 at a default. On a thumb, I probably would go even smaller to like a 2. You can even do a 2.5, okay? But I'm going to go ahead and pretty much I just want to get this thumb in the center of my picture frame, right? In the center of my field of view. So over here, I'm going to need a lot more slices. I'm going to now probably, I'm going to type in about 20 slices. I might even change my slice thickness back to 2.5 so I don't have to add so many slices, and maybe go to now 30 slices. And pretty much when you're scanning the thumb, what you're interested in is that, you know, it's going to be dependent, I guess. You could be looking for some thenar muscle issues, or many times if it's like that gamekeeper's thumb or that skier's thumb, we're looking at the metacarpal phalangeal joint. So we're looking at this joint here, right in the center there. So your coverage then, you know, we want to get pretty much as much of the thumb as you can. Notice here is that thenar muscle, is that nice thick fatty part of your palm, right? I might even add 5 more slices just to get this entire thumb on my picture. And as far as setting it up here, you know, you can try to maybe angle it. If I look at the actual metacarpal here, I'm going to set up axials, and I'm going to get axials in this plane, and this is my field of view. Okay? Phase direction, if I look over here, I have a phase direction of A to P or right to left. Well, I know for sure I do not want right to left because I'm going to have part of the other abdominal area wrapping in. So I'm going to pick my phase to go A to P. Now, do you need fold over? Your fold over is going to be dependent on whether or not these fingers wrap down here. Because if you have like your other finger wrapping down, you could get some fold over A to P. So just to be safe, I'm going to turn on fold over suppression. Okay? I like how my geometry pictures look, I have a 0.4, 0.5 voxel size, which is very small. Now notice, if I take my slice thickness, and if I bring my slice thickness down, then to compensate for signal, then sometimes I'll bring my voxel size up. So let's go to 0.6. And I like to keep my voxels square many times. So I'm going to change it to a 0.6 to 0.6. That gave me more signal in each voxel. And I have a very small slice thickness, and I have a very tiny field of view. So technically, I still got good resolution in my images, right? Because again, what affects spatial resolution? Spatial resolution, it's your field of view, it's your slice thickness, it's your matrix, right? Or my voxel size here. So this all looks good. I'm going to now go to my contrast. I want it to be T2 weighted. I have 2595 at 30. That's too low of a TE for my T2 weighting. So I'm going to go ahead and change it to at least like probably an 80. My TR, actual TR is 2,595. I like that. And I could probably bring my TSC factor up to probably around that 20 to 22 range. And that'll give me then about a 3-minute scan, and I have 4 necks. So that's actually pretty good. I think I'm going to run it just like that. So this, in parentheses, under viewing series 5, that is the axial that you just took. So now I'm going to replace my viewport here and put under, it's on the series 5, I'm going to pick my better axial here because I can see my sesamoid bones. Okay? Now I'm going to set it for a T1 sagittal of the thumb. So I'm going to go over to my field of view and I'm going to straighten this up. This field of view actually looks pretty good. I have a 100 by 100 or a 10 centimeter field of view. If you wanted to bring in your field of view A to P, you probably could. I can probably bring that A to P into 8 and into around 80. Keep my foot to head at 100, right? This would be a good sagittal of the thumb picture frame. I'm going to go to a, because I'm going to be doing the thumb, either a 2 or a 2.5 slice thickness at default would be good. So if I'm going to angle, if I'm going to do a sagittal, I want to be perpendicular to these sesamoid bones. So I'm going to take a line and draw it from one sesamoid to the next and be perpendicular to it. This will give me a true sagittal of the thumb. And if you'd have a good coronal, which this is more of a coronal oblique, you could then see how does this correlate in this particular viewport as well. But I think we're pretty good. I think if we just keep this to be perpendicular to these sesamoid bones, I'm going out to this first or the second digit only because let's say I want to include all of the thenar muscles in my thumb region because we know that those muscles attach to the thumb, right? And that would be over here in that sagittal viewport to kind of look at. So I just need it to be T1 weighted. I'm going to go to my contrast. I have a 4 TSE, I have a 500 TR and a 30 TE. That will give me T1 weighted. Yes, Shalika?
I know I always have a question, but
No.
I'm looking at our book, our MRI scanning book. There's no protocol for the thumb in it?
Nope, there is not, no.
Okay.
It actually just has of the hand. in there, but it does not have of the thumb. Nope. Okay, so the reason I'm teaching the thumb is because of the fact, again, it's pretty straightforward with your fingers, right, of what's coronal and what's sagittal. But because the thumb is laying in the magnet many times at an oblique fashion, it's hard then to say, how do I angle for that? How do I get a true coronal and how do I get a true sagittal? And this is how you do it, is by looking at these sesamoid bones. Okay? I'm going to go back to this contrast page, and I noticed that it's on a user-defined of 500. So I told the system I only want to use 500, but it's telling me it has to use 5 packages. Well, I'm going to go ahead and see what my shortest TR is. Well, the shortest TR is 1,145. Well, that doesn't cut it for T1. So now I'm going to go back to a range and say, you know what? I want the lowest to be 300 and maybe the highest to be 700. And then what it gives me is a TR of 572 in 4 packages. So it did drop a package for me. Okay? Again, 4 is like, that's the top of the range for the turbo factors that I like to use. I have a TE of 30. That looks good. I have a NSA of 2. It's under 4 minutes. This would be good to run, or if by chance that patient is in pain, turn on sense. And again, I have to change my coil up here. And then I'd be able to go ahead and get it quicker. Okay? Proceed and start. The very last one is a stir coronal. So I'm going to go ahead over to my sagittal viewport and I'm going to put a better sagittal up, which is here. There we go. So there, it's a good sagittal here. You can see the flexor tendon here that comes off of the thenar muscle. This is the metacarpal phalangeal joint, and here's one of my sesamoid bones. So now I'm going to do a stir coronal. I'm going to go ahead and bring my field of view box over my coronal, and notice I'm going to need a smaller field of view. We're using around, what, 100? Bring that down, whoops, bring this down so you can get the entire thumb on. Okay, I'm going to just, there we go. Whoa, whoa, whoa. So if I bring that into the center, I can bring my A to P field of view in more. I can probably go like to 80. And I want to keep my foot to head as 100. Probably even bring your A to P down, maybe even 70, because, you know, notice that A to P, this is going to, you know, give me, I'm doing more of a rectangle, right, in this coronal plane. I'm going to go down to a 2 millimeter field of view at default. Now I'm going to angle my slices to be parallel, and I'm sorry, this way. This is going to be my coronal. Parallel with the sesamoids, and I probably don't need that many slices. So if I bring it down to about 15 slices, if I look over here, now I can go ahead and off of the sagittal, I can kind of straighten it up, and if you wanted to, you can get a coronal to go right through that metacarpal bone. And I've got all of the thenar muscle included. Here's my field of view in the middle viewport, and then here's how, oops, here's how I have it angled off of my axial. So this is how I would position my slices to get a good coronal image of the thumb. I'm gonna go to my contrast. This is a stir. So I want to do about a 140 IR delay. Okay. I have a TE of 30. I think with our stirs, we're running around that 40 to 60. So if you want to just go on the low end of 40, I'll give you a little bit more signal. Got a turbo factor of 15, and that's pretty decent for a stir. I got a 2800 TR. That looks pretty good. I have a 3 necks, and that's really good for a stir because it's only 2 minutes and 20 seconds. And notice that, you know, I actually have only 15 slices because I'm just scanning a thumb. You know, I don't need that many slices to get through the thumb. 2 minutes and 20 seconds, I like it. Looks good. I can proceed and start. We're going to go to viewing, and we're going to pull up now a T1 sagittal. And that's going to be in series 7 here. And then what I'm just basically asking you to show me is, where is the flexor tendon on these axial images? So hopefully by or not axial, on these sagittal. So hopefully by looking, you're going to notice right off the bat that the thenar muscles are here, and then I know that this tendon is going to be a flexor tendon. It's in the palmar aspect of the thumb. The tendon back here is your extensor. I'm going to go to a coronal, and I'm going to ask you then to page through here and tell me, where is that UCL? And that UCL then, that gamekeeper's thumb, is going to be in this area here. Because I know this is my metacarpal, this is my proximal phalanx, and my distal phalanx of my thumb. And this is a nice coronal picture of the thumb, because I can see that there is a ligament here. There is a ligament here connecting these bones. The ligament on this side is your UCL, and then the ligament over here is your RCL. So that's what you need to point out to me in the practical as well. So that is it in setting up for a thumb. What do you guys think? Does this seem as simple as the wrist? No. It does seem a little bit